Hi, my name is Carmen Henniger, and my project is on suicide in the United States, Mexico, and Canada. In the United States, the GDP is $29.18 trillion. The international rank is number three. The median household income in 2024 is $83,730. The percent living in poverty in 2023 is 11.1%. Life expectancy is 76.4 years, and the infant mortality rate per 1,000 births is 5.41. And the percent GDP spent on healthcare in 2023 is 17.6%. In the United States, there is a mixed healthcare system using the Bismarck national health insurance and out-of-pocket. In the United States, the strengths of this healthcare system is that there's specialized care, more options, and better research. And the weaknesses is that it's expensive, there's not as easy access in rural places, and the waiting times. In the United States, financing is by employers, the government, using Medicare and Medicaid, and individual funding. Insurance, there's insurance companies, and there's also self-insurance. For delivery, there's hospitals, clinics, and community health centers. And providers, there's physicians that are paid by private institutions. In Mexico, the GDP is $1.789 trillion. The international rank is 12th. The median household income is $12,757. The percent living in poverty is 43.9%. The life expectancy is 75.069 years. The infant mortality rate is 12.5 deaths per 1,000 births, and the percent GDP spent on healthcare is 5.9%. In Mexico, there's also a mixed healthcare system. However, most are uninsured, therefore, out of pocket is most commonly used. The strengths is that there's free public healthcare if you can find a public hospital or anything, but that's pretty hard to find. And the weaknesses is that there's few hospitals in rural areas and it's difficult to get appointments and expensive when you're paying out of pocket. For financing, it's by employers and the government and out of pocket. For insurance, there's Social Security and IMSS and private. And then for delivery, there's public hospitals, Federal Ministry of Health, and state ministries, and of course, private. And providers, there's public, Social Security, and private. In Canada, there's the GDP is $2.142 trillion. The international rank is 10th. The median household income is $68,400. Percent living in poverty is 10.9%. The life expectancy is 82 years. The infant mortality rate is 5.1 per 1,000 births. The percent GDP spent on healthcare is 11.2%. And they use the National Health Insurance healthcare system. The strengths is that it's available to everyone and a majority of the costs are covered, and the weaknesses are the wait times and the accessibility. Uh, in Canada, the financing is by the government using tax money. The insurance is public with Medicare. The delivery is private hospitals and providers is government paid and privately hired. And of course, social determinants of health have a lot to do with the rates. Uh, Using the neighborhood and environment, health and healthcare, social and community context, education, economic stability, that is obviously going to have an effect on some of my statistics as well. The suicide rate in the United States is 5.11 per 100,000 people, and the data is leveling out to about the same amount of deaths per year. In Mexico, it is 6.95% and is also pretty leveled out. In Canada, it is 12.9% and it appears to be decreasing, but it is also pretty leveled out. Suicide in the United States, so over 49,000 people died from suicide in 2023. 22.7 per 100,000 people that commit suicide are male and 5.9 are female. The highest rate of suicide based on race is non-Hispanic American Indian / Alaskan Native, which is 23.8 per 100,000. And the lowest is non-Hispanic Asian, which is 6.5. Suicide in Mexico, there are nearly 9,000 suicides in 2023, and the rate of men is much higher than females, but it is hard to find data on Mexico, reliable data, I should say. And then in Canada, there's 4,500 suicides per year, and it's also much higher for males than females. And the lowest rate per race is from North America at 3.5%, and the highest rate is Asia at 45%. There are several different ways to prevent suicide in each country. These are some of the options I found, which is like therapy, hotlines, medications, and awareness programs. Um, However, suicide is situational and is hard to get help beforehand unless they reach out for help because you don't know what someone is going through. And suicide is outside of the scope of healthcare because there's a lack of training, protocols, and resources. And then I used Grammarly to check my spelling and grammar, and I used Google Gemini to help organize my ideas.